Coming up for 12 after 9 on this Friday morning. Now, even if the current vaccine trial were to succeed, nearly 61% of the world's population won't get access to it just yet. Why? Because wealthy nations representing just 13% of the population have already bought more than half of the promised doses. Well, Oxfam says the vaccine should be made available to everyone. Its South Africa Program Manager Mthandazo Ndlovu unpacks this with us this morning. Mthandazo, very good morning and thanks so much for your time. So let's talk about how you actually know this. What do you know and how do you know it?
Perfect. Thanks. Yeah, certainly what we know is that 13% of the world's wealthiest nations have made advances in terms of securing the vaccine that is under development for over 51% of what is being considered now. But of course, our data is sourced from the tool that is called the Access to COVID tool, which is ACT, but also using the calculations from the Affinity. And based on that and our research, we have made the calculations that it would cost, I think, at least above 70.6 billion for the whole planet to access the COVID-19 vaccine. But at this stage, because of the dominance of the multinational corporations and the undue influence that they have over the democratic space, they have made commitments to the pharmaceutical companies that would ensure that the majority of the world does not access the vaccine as and when it is needed and in an equitable manner. So that is a bit of unjust to live with. Yeah.
Just give us a bit more insight into what data you actually have access to, and in your analysis of this, what have you actually seen to make you say this, that this is the percentage, the wealthy nations are actually buying this up? What are you seeing? Are you seeing transactions? Are you seeing payments? Are you seeing orders being placed? How do you get to this conclusion?
Certainly, it's a simple one. It's orders that have been placed as simply as that by the wealthiest nations such as Japan, Hong Kong, Switzerland. They have made agreements with the pharmaceutical companies. So it's as good as that. And looking at the population dynamics and the figures, statistics of these countries, you can then clearly see that it is just above 13% of the world's population, and they have already kind of secured 51% of the vaccine that is under development and being considered. So it's simply those statistics, and we think it is unfair that they should be through the World Health Organization systems that are created that ensure and guarantees equitable distribution and access to the vaccine for all, but particularly for the most vulnerable groups in society. You know?
And that's what I want to ask you about. I mean, we have the COVAX facility. It is it is the world's largest operation and fastest as well. It's meant to ensure, that's the aim, is to ensure that everybody everywhere gets a shot, pardon the pun, at these vaccines, that it is equitably distributed. Now, where does that fall into this? How does this work? You would know better than we do as Oxfam, you know, how a system like that can sort of fall by the wayside and allow companies, if this is true, or countries to lay claim to so many vaccines.
One of the biggest challenges, I guess, is our issue of the patent rights that has not been democratized. So I think that space needs to be democratized, and there should be worldwide sharing of knowledge, data and technologies with a pool of vaccine licenses available freely to all countries. But at this stage, unfortunately, there seem to be rules that favor a few, and we're saying now it is not the time to allow for interest of the very few, but also the interest of profit-making companies to place orders before universal access and the need to save lives at a global level. So these are some of the biggest challenges. And of course, individual countries are slowly subscribing and being party to the World Health Organization's process that is meant to pool and coordinate global efforts. So global systems are not yet democratized, but I think there's light in the sense that Africa seems to be a little bit coordinated, and the underdeveloped world seems much coordinated, but at the same time, because of resources, they are not able to kind of secure their space, but which we are saying it is not supposed to be, because there should be a system that equitably distributes the vaccine, and this should be a people's vaccine. Yeah.
So you would know also what mechanisms are out there. Firstly, what needs to be done for everything that you said that actually needs to happen for this to be a fair process, and what mechanisms are out there other than this COVAX facility to ensure that nobody monopolizes the vaccine when it does get here.
Yeah, I think first thing we must prevent monopolies. I think from being at the forefront of distributing of the vaccine, and we prevent preferential treatment in terms of access to vaccine. World Health Organization should be at the center of the distribution channels, and also establishing mechanisms across the world and establishing hubs in various geographies, Africa, Latin America, Asia, Europe, such that there is equitable access to the vaccine. And of course, there's a strategic need to also ensure that the spaces are democratized and there is equal participation, not participation and access based on one's economies of scale. Yeah.
And as we've seen, even a pandemic, Mthandazo, is not free of politics. Thanks so much for your time. Let's cross our fingers that the due process is followed at the time, because this problem affects everybody in every corner of the world at the moment.